Good evening. I just finished watching Seco, the documentary from Michael Moore about the healthcare system in the US before the Obamacare and how bad it was and it has been for so many people and what it made me realize once again it's how grateful we should be. Italians, French, Swedish, English, Spanish, Europeans, we have to be grateful for the system we live in. We should not take it for granted because so many people don't have it. Millions, millions of people, even if they live in an economic system of a country that uh, would have the money to do that, they don't have it. Not to talk about the I don't know how many millions of people that don't have anything. But even if we live in a wealthy country, it doesn't mean we shouldn't take these things for granted at all. We have to take care about those things. So many people blame the the hospital layout, the healthcare system works, that it takes so much time to book for anything. But you should actually think, hell, I can afford this. I can afford it because it's public. Because otherwise, I wouldn't be able with my income to pay for this problem that I have for curing my son, my daughter, my parents. You know, people shouldn't be dumped on the street like garbage just because their insurance has finished and they don't have any money to pay for staying in the hospital. Um, because that's what happens. That's what happens in those cases. It's real. Real people have to live in those conditions and face those moments as if they weren't human beings. This is about, we talk about so much about human rights, etc. Healthcare is a fucking human right. I mean, if you can't protect life, what do you want to protect? It scares me so much. It scares me so much. It scares me so much that so many people don't realize how lucky we are and how much we have to fight to keep this system going on because it's worth it. You know, um, I don't think that all with the taxes we pay go to services that are worth it. But I don't mean that. I mean having a tax system that contributes to public welfare is something astonishing. Um, that we owe our life to this. You know, and I tell you this, I have quite a close experience with my family. I never met my granddad from my father's side, but when my father was very young, he was just 10 years old, he died. Uh, it was before 1978, and before 1978 in Italy, the healthcare system was private, and he, he had quite well conditions from a wealth standpoint. Uh, he worked in a factory. He had a degree in chemistry that for the time it was quite advanced, and then he got uh, lung tumor and lung cancer, and they spent all the money they had. Uh, that they sold their house and they went to live in a cheaper one. They they sold they sold everything they had, and then didn't manage to cure him. and then the ending was that he died, and they didn't have a cent to live. So that's why my father went working when he was just 13 years old, right? That's what happens. So please, 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 please realize, put things into perspective. Look at the word, make a ranking, and realize where you are and why you are where you are. And if you deserve it, and realize that other people deserve it. So keep caring about our healthcare system, guys. We have to be careful about it. We have to take care, because if we want to take care about other people, we have to take care about our healthcare system. That's a more practical and real way to do it.